Hello everyone, welcome to our channel Students Homeopathy and let's learn together. Today we are going to discuss a very important ongoing disease among women, that is Polycystic Ovarian Syndrome and its homeopathic management. So let's start. At the outset, we should know what is Polycystic Ovarian Syndrome, that is PCOS. So PCOS is a condition where patients suffer from many small cysts in their ovaries. Poly means many. So, these cysts occur when the regular changes that normally happen to the menstrual cycle are disturbed. So, this causes the ovary to enlarge and secrete huge amounts of estrogenic and androgen hormones, thus causing infertility. In this condition, the hormones of a woman go out of balance, which creates some signs and symptoms. They are irregular period or delayed menstrual cycle. It is due to the abnormality in maturation of the eggs. Next, hirsutism means massive hair on the body and face or parts of the body where men usually have hair, due to increased androgen level. Next, difficulty in conceiving. It is due to irregular or failed ovulation. The hormonal imbalance in the body prevents the follicles from maturing and releasing the egg, causing delayed or failed ovulation. Next, hair loss or excessive thinning of hair also can happen in PCOS. This is happening due to the increased androgen in the body. Next, weight gain. Then acne on the face, upper back and chest also can happen in PCOS. Coming to the complication part, if it is left untreated, it can lead to further health complications like heart diseases, diabetes, obesity, etc. Next, coming to some of the causes of PCOS. So first comes heredity. Heredity is found to be one of the major causes of PCOS and can be transferred as a heredity component from mother to her daughter. If there has been any existing family history of PCOS, then there are great chances of PCOS being transferred to the next generation, since heredity and genetic factors play a vital role. Next, obesity. Obesity is both a cause and effect of PCOS. Obesity is also an important reason that can give rise to PCOS. This happens because of the fact that the fatty tissues are hormonally very active and produce high amounts of estrogen, which causes an interference with the normal ovulation cycle. Next, insulin resistance or higher level of insulin. It is also an important factor that gives rise to PCOS. Insulin is a hormone produced by the pancreas that allows the cells of the body to use sugar as the body's primary energy source. Now, if the cells of the body become resistant to insulin's action, the body produces more insulin, which elevates the level of sugar, causing hormonal imbalance in the body, and excess insulin might increase the production of androgen, which interferes with the normal ovulation cycle, thus causing PCOS. Next, low-grade inflammation is also one of the reasons for PCOS. Next, coming to general management. Though the cure for PCOS is yet to be determined, still, with proper treatment and lifestyle modification, we can manage the condition. So first, balanced and healthy diet. Focus should be on the wholesome food, as these do not contain any preservatives, artificial sugar, chemicals and hormones. Fresh fruits, veggies, legumes and whole grains should be added to the diet. Processed food products should be avoided. Always limit your carb intake. Make sure to have healthy portion of protein in the diet. It is very important. And magnesium and iron rich fruits like Broccoli, spinach, bananas, dates, eggs, almond and cashew nuts should be added in the diet as these are PCOS friendly. Then high fiber diet, which includes beans, lentils, pears, etc. should be included in the diet. Anti-inflammatory food, which includes greeny leafy vegetables, tomatoes, olives and fatty fish, etc. should be added to the diet. Next comes exercise. So as you all know, exercise is the most useful and beneficial activity of the day. So exercise for at least 30 minutes regularly can help prevent insulin resistance. Next, weight loss. Maintaining a healthy weight is the key to managing PCOS. Weight loss can keep your androgen and insulin levels in check and simultaneously restoring and regularizing your ovulation cycle. Next, coming to the homeopathic treatment. As you all know, homeopathic treatment for PCOS is quite effective in nature, as its ultimate focus is on curing the disease from the roots and not just suppressing the symptoms. The totality of the symptoms, individuality or constitution of the patient should be considered for selecting any homeopathic medicine for PCOS. Medicine should be taken in consultation with a good homeopathic physician. So let's discuss some commonly indicated homeopathic medicine for PCOS with their important indication. So the medicines are sepia. Sepia is a very good remedy for PCOS with scanty or late menses along with the bearing down pain. Sepia efficiently regulates the menstrual cycle and also helps in treating infertility. Next, pulsatilla. Pulsatilla is a very good remedy that helps manage extremely irregular and suppressed periods. It can help with a regular flow of periods and maintain the menstrual cycle. Next, calcarea carb. Calcarea carb is a very good remedy for PCOS who suffer profuse bleeding during their period. It is suitable for women who have longer periods than the usual one. Next, natrimur. It is extremely effective in women with PCOS who have irregular menstrual cycle and having difficulty in conceiving. Apis. Apis is very beneficial for women who deal with pain in the ovaries. Next, lachesis. It is very effective for women who have short periods, have abdominal pain that lasts till they get their period. It can be taken for PCOS with repulsion to clothes that are tight. Next, thuja. Thuja is very much beneficial for women with delayed menstrual flow due to PCOS. It is effective for women with multiple cysts on their ovaries. It works wonderfully by dissolving abnormal tissue growth and treating excessive body hair due to hormonal imbalance. Next, euphrasia. It is also a very good remedy for women who suffer from a shorter menstrual cycle than the usual one due to the PCOS. Next, kali carb. It is another good remedy for women who do not get their periods for several months due to PCOS. It helps with a regular menstrual flow. So that's all for this video. If you have not yet subscribed to our channel Students Homeopathy, please subscribe it now and also click on the bell icon and select all so that you will not miss any of our informative, educational and interesting videos on homeopathy. And please provide your feedback in the comment section. Also, we will love to answer your queries on this topic. Thank you for watching.